Guests, ladies and gentlemen, for me, it's a special day because I've never had an opportunity to address this very special congregation. So from the onset, I feel privileged to be here and be able to say a few things about what I know about nursing and midwifery. I want first to thank the organizers of this conference. It's indeed a very important conference. And I want to thank the originators or the pioneers who came up with this brilliant idea to come up with this caucus for all the nurses and midwives that work together in the Eastern, Central, and Southern African region to come together so that they can be able to share their experiences and frustrations, if there are any, in this area of a very important profession that is unique to mankind. I want to note with appreciation the objectives of ECSACON, because you are keen to ensure that you have a clearly spelled out professional practice and standards. And you want to ensure that you have key competencies that you need to observe, as well as observing the requisite curriculum for this noble profession. And particularly overall, to strengthen this noble profession, which without nurses, I strongly believe healthcare will be at a great risk, because as it has been already observed, nurses and midwives constitute more than 60% of the workforce of the healthcare in our country, and I believe in the other countries. Therefore, coming together is a very brilliant thing to come to do so that you can be able to share your experiences. As counties, more than between 15 and 30% of our budget is dedicated to healthcare. And in our health facilities, more than 3/4 of the workforce are nurses. And therefore, nurses form a very strong foundation of our healthcare system at the county level and at the national level. Therefore, every effort must be made to support this core and a fundamental team of workforce, that without the workforce, we cannot have a well-structured and functioning healthcare system in our country. I want to take this opportunity to thank you on behalf of my colleagues, the governors in the 47 counties, for the great job you are doing in our counties. We appreciate the work you are doing. We indeed appreciate the work you are doing, and we wish that we can create the best working environment that you require to discharge your duties. However, because of various reasons, particularly resources, sometimes we are handicapped in terms of providing the enabling environment for you to function in a very clearly structured manner. However, I want to note that we are very appreciative of the work you are doing for our country. Universal health care is a very important initiative by our country through His Excellency the President of the Republic of Kenya, and we support it as county governments. We believe it is the way to go. However, we are facing a lot of challenges which we hope that in the long run we shall be able to find solutions. The key among those challenges is actually the human resource. Having the people to do the work. Having the nurses, the midwives, and all the other professionals who are able to do the work. That is a big challenge. And most of our counties, we have a serious shortage of workforce, specifically nurses and other cadres. Therefore, it's an area that we need to put a lot of emphasis. The second area of importance is the availability of requisite facilities in our health facilities throughout our counties. We do not have the requisite facilities that are necessary for the nurses and the medical fraternity to discharge their duties to their best of their ability. So it's an area that we need to improve. As much as we may wish to give insurance to our people so that they can access free medical care. But the challenge we have faced, particularly in the 4 counties that have been used as on a piloting basis, has been lack of human resource in those facilities and poor infrastructure. So those are the areas that we need to cover. Equally, the issue of drugs and other required materials that are needed, we find that's a challenge. Most of our health facilities do not have the requisite drugs at any given time. And this is as a result of poor budgeting or allocation of scarce resources to this sector. And therefore, if we wish to succeed in universal health care, we need to put in more budget in this sector so that we can be able to move forward as expected. I wish just to say a few remarks about what we have been able to do in Vihiga for the last 2 years that I have been in the office as the governor of the county. First and foremost, we needed an enabling institutional framework to enable us function and be able to discharge our duties. And in my manifesto, I recognize that primary health was core to universal health care. So within our CIDP, we mainstream primary health care as a main focus in dealing with universal health care in our county. Also, we required to put in place policies that would enable us to transact our businesses in the sector seamlessly. So having the right policies is a must. Without the right policies, you find yourself trying to do things through trial and error. And that's a very expensive way to go. So for us, we spend more time putting the right legal framework, the right policies in place, and the right plans. After that, the next was the implementation of those policies and the legislation that we had put in place. And as a result of that, we realized that through the audit of our facilities, we realized that our facilities did not meet the required standards to be able to provide services for universal health care. And therefore, we had to put in enough resources to revamp and renovate and equip those facilities to the required minimum level so that they could act as main areas that would be used to discharge duties that are related to universal health care. So that was one of the key areas we put in place. Then the next was to ensure that we have the right workforce. Because it is one thing to equip those facilities, put up nice laboratories, but if you don't have the workforce, then you can't discharge the duties. Therefore, the recruitment of staff is very crucial. And I want to note from the onstart that we have a general shortage of nurses in all our facilities throughout the whole country, and particularly in some of the counties that had certain challenges earlier on. So recruitment of nurses and midwives and all these laboratory technicians is a very important exercise that must be taken into if we have to discharge our duties. So having done that, I'm happy to say that we are now in the process already discharging our duties as expected, although we still have not reached where we want to be. We still want to employ more nurses, more technicians, more doctors, so that we can be able to provide services. We still need to provide more equipment to our health facilities so that we can be able to provide the required services. One of the projects we have focused on, which we deem extremely important, is the maternal care project, a project which is looking at our mothers and children, and children, particularly our mothers, our pregnant mothers, who then have, over the period of pregnancy, have to go through various stages of going through the healthcare process. And through that, we found out that in Vihiga, our mortality rates were so high. And as a result, we have put more focus on that area so that we can be able to take care of our mothers who during the pregnancy period must be able to attend to antenatal services in our health facilities as required, and must receive the required examinations until they get to period of delivery, where our focus is that we must make sure that they get to the hospitals and deliver in the hospitals where we have requisite facilities to ensure that at least we minimize any chance of mother or child mortality. So, in a nutshell, I want to say that we have done much that we can, but we have a long way to go. And we are not the only one county. Most of the counties have the same challenges, and we need to work together as a team to be able to succeed. And in conclusion, I want to say that as nurses and midwives, I want to say you are doing a good job. We want, as counties, to recruit more staff so that you can provide the services that are required. And last and not least, we are committed to see to it that you are well remunerated for the services you provide. Because I think the services you provide are so huge that when you compare with the remuneration you receive, there is no comparison. So we are committed to that, and that's why we are pushing to get more money given to counties so that we can be able to give most of these resources to the healthcare system. Thank you very much for listening to me, and I thank you for inviting me and wish you a very successful conference. Thank you.
Thank you very much.